I'm here because we're working on some initiatives internally to try and help our patients that maybe don't have family to take them home. They don't have the ways or means to pay for it. And what happens is a lot of times these patients are brought in via ambulance because they don't have resources to go to the doctor's office or something. They sit in the emergency room, so they kind of find themselves stuck.
The average person that comes to our mental health clinic has a very low income, and a lot of the people don't have their own transportation, so it creates a real barrier for them.
I grew up here in Taft. Of course, I was born with a disability. Well, there's days when I spend 2 hours on the bus. That doesn't help me because it causes me a lot of lower back pain, and then we have to go through all those bumps. So there's times when by the time I get here, even whether it's going over there or coming back, I slide off the seat and have to pick myself back up. Slide off, sit back up.
Through a planning grant from the National Aging and Disability Transportation Center, we're deploying mobility as a service, expanding mobility options, but also factoring in things in public health.
Everyone here knows our problems. You can go from one city to another and not run into anything. It's 30, 40 miles. And I was the only driver for this area. We basically had to have the veteran meet us either at the clinic or at a centrally located location. So I would pick up in Corpus at the VA clinic, and I would stop in Robstown, Kingsville, Rivera, Raymondville, all the way down to the valley.
One of the areas that have been identified with great need is the Colonias. In the coastal bend, there are approximately 30,000 people that live in these isolated rural communities.
It's very unhealthy to live in a colonia. A lot of diseases out there.
They depend on family, or friends that are driving. Because that's, they've been told that a lot.
Some need transportation to go get their medicines to see the doctor. A lot of them need transportation to go pay their utility bills. Some have to go out of town for dialysis. Some even go to San Antonio.
Our focus is not just on providing transportation to get them to the doctor, but also finding ways to improve public health, such as finding organizations who can help us improve the water quality for residents.
And we don't drink city water, much less if you're living out there. The people are drinking water. They run out of water. Here it's easy for us. We just go to the grocery store. But over there, sometimes no transportation, sometimes no money.
Remember, the lady lives in another street. The doctor told her she got cancer because of the water.
Nobody drinks the water from here. Nobody. See, when he got the infection, the doctor asked me also. He said, "You've got a staph infection," and it was, that one would have gone to your heart, you would be gone. I said, "Can I ask you a question? If he was taking a bath with the water from where we live," I said, "and it has arsen, could that have been in?" He said, "Was he using the water from over to take a bath?" I said, "There was only one time he used it because I hadn't gone to town to get water, so he took a shower with it." You know that probably caused the infection because he had taken a bath with that water.
Access to transportation and basic needs such as clean water should not be out of reach in the United States today. We are passionate about increasing mobility options and quality of life in the Coastal Bend. Join us.